Welcome back to my channel. And if you are visiting this space for the first time, you are also highly welcome. This is another quiz time. And in this section, we would be looking at questions that are related to the blood supply of the pelvis. The first question here reads that the internal pudendal artery is branched from the posterior trunk of the internal iliac artery? Or is it that the internal pudendal artery is the main arterial supply of the gluteal region? Or is it that the internal pudendal artery is branched from the external iliac artery? Or finally, is it that the internal pudendal artery is branched from the anterior trunk of the internal iliac artery? Out of all these options, the correct option here is that the internal pudendal artery is branched from the anterior trunk of the internal iliac artery. We've highlighted this in our previous lecture on the internal iliac artery. In that lecture, we described the different branches of both the anterior and the posterior trunks of the internal iliac artery. If you've not checked that lecture up, please kindly go and do so. So the internal pudendal artery is branched from the anterior trunk of the internal iliac artery. This option is the correct option out of all the listed. The second question here reads that the posterior trunk of the internal iliac artery gives all of the following except, is it except the iliolumbar artery? Is it except the lateral sacral artery? Is it except the inferior gluteal artery? Or is it except the superior gluteal artery? So which of these options here is not given off by the posterior trunk of the internal iliac artery? The correct answer here is the inferior gluteal artery. It is the inferior gluteal artery that is the correct option here, as this artery is not seen as a branch of the posterior trunk of the internal iliac artery. The posterior trunk of the internal iliac artery is seen to give off the iliolumbar artery, the lateral sacral artery, and also the superior gluteal artery. The inferior gluteal artery is not a branch of the posterior trunk of the internal iliac artery. It is a branch from the anterior trunk of the internal iliac artery. So this option here, the inferior gluteal artery, is the correct answer. So the third question here reads that the internal pudendal artery supplies mainly, is it the perineum? Is it the gluteal region? Is it the medial thigh? Or is it the pelvic viscera? So out of all these options, the correct option here is the perineum. The internal pudendal artery is seen to supply mainly different structures that are located within the perineum. The fourth question here reads that the umbilical artery becomes obliterated during the developmental process. Is the umbilical artery seen to give the internal pudendal artery? The umbilical artery remains as the median umbilical ligament. The umbilical artery gives the inferior vesical artery. The correct option here is that the umbilical artery remains as the medial umbilical ligament. The umbilical artery is seen as a functional artery during the developmental process, and after birth, this artery becomes obliterated, and it is seen to become transformed into the median umbilical ligament. So this is the correct option here. The fifth question reads that the internal pudendal artery gives the following except, is it except the deep artery of the penis or the deep artery of the clitoris? Is it except the superior rectal artery? Is it except the perineal artery? Is it except the dorsal artery of the penis or the dorsal artery of the clitoris? Which of this is not a branch of the internal pudendal artery? And the correct option here is the superior rectal artery. All the other options that are listed are branches of the internal pudendal artery, except the superior rectal artery. The superior rectal artery is branched from the inferior mesenteric artery. This is what is seen to provide supply for the superior region of the rectum. All the other arteries that are listed here are branches of the internal pudendal artery, except for this artery. The sixth question reads that the uterine artery. The uterine artery, is it a branch from the posterior trunk of the internal iliac artery? Is the uterine artery seen to supply mainly the ovary? Is the uterine artery seen as a branch from the external iliac artery? Is the uterine artery seen as a branch from the anterior trunk of the internal iliac artery? So out of all these options, which is correct about the uterine artery? And the correct option here is that the uterine artery is the branch from the anterior trunk of the internal iliac artery. All the other options here are incorrect. If you look at the first option, which reads that the uterine artery is a branch from the posterior trunk of the internal iliac artery, this is false. The uterine artery is not a branch from the posterior trunk. It is branch from the anterior trunk of the internal iliac artery. The second option also reads that the uterine artery supplies mainly the ovary. The ovary has its own arterial supply, which is the ovarian artery. So it is not seen to be providing the main supply for the ovary. Then the third option here reads that the uterine artery is branch from the external iliac artery. The uterine artery is not a branch from the external iliac artery. We know that the external iliac artery supplies mainly the lower limb. The uterine artery is seen as a branch from the internal iliac artery, and it is specifically seen to branch from the anterior trunk of the internal iliac artery. So this makes the last option here, which states that the uterine artery is a branch from the anterior trunk of the internal iliac artery, as the correct option. The seventh question reads that the blood supply to the superior region of the urinary bladder typically arises from the dash. So where is it seen to arise from? Is it from the umbilical artery? Is it from the uterine artery? Is it from the inferior gluteal artery? Or is it from the superior gluteal artery? So which of these options here gives us the branch that supplies the superior region of the urinary bladder? The correct answer here is the umbilical artery. We said that the umbilical artery is a functional artery during the developmental process, and after birth, this artery is seen to become obliterated. Before it becomes obliterated, it is seen to give up the superior vesical artery, which is seen to supply the superior region of the urinary bladder. So this umbilical artery is the correct option here, because it is this artery that gives off the superior vesical artery that supplies the superior region of the urinary bladder. Question 8 here reads that the prostate gland is supplied mainly by, is it supplied mainly by the dorsal artery of the penis? Is it supplied mainly by the inferior vesical artery? Is it supplied mainly by the umbilical artery? Or is it supplied mainly by the superior vesical artery? The arterial supply of the prostate is chiefly by the inferior vesical artery. This inferior vesical artery is a direct branch from the anterior trunk of the internal iliac artery, and it is seen to provide supply for the lower region or inferior region of the urinary bladder. And we know that the prostate gland is located at this specific region, and this is where it also gives a branch, also supply the prostate gland. So the prostate gland is supplied mainly by branches from the inferior vesical artery. So this option here is the correct option. The ninth question reads that the internal pudendal artery, the internal pudendal artery is seen to exit the pelvic cavity through the lesser sciatic foramen. Is the internal pudendal artery seen to enter the perineum through the greater sciatic foramen? Is the internal pudendal artery seen to enter the perineum through the lesser sciatic foramen? Or is the internal pudendal artery seen to exit the pelvic cavity through the obliterator foramen? If you go through a lecture on the internal pudendal artery, in that lecture we describe the course or the path it runs from one region to the other. So going through these options, the correct option here is that the internal pudendal artery is seen to enter the perineum through the lesser sciatic foramen. We know that the internal pudendal artery is one of the terminal branches of the anterior trunk of the internal iliac artery. And after its emergence within the pelvic cavity, it is seen to exit the pelvic cavity through the greater sciatic foramen. This is where it finds itself within the gluteal region. From this region, it is seen to make a turn where it is redirected through the lesser sciatic foramen. And it is through this foramen that it now enters into the perineum. And this is where it will be seen to give off its branches. So this option here, the internal pudendal artery enters the perineum through the lesser sciatic foramen, is the correct option. The 10th question, which is the last question, reads that which is correct concerning the general blood supply of the pelvic cavity. Is it that the abdominal aorta bifurcates at the 12th thoracic vertebral level into the common iliac arteries? Is it that the internal iliac artery supplies mainly the pelvis? Or is it that the pelvic organs are supplied by branches from the external iliac artery? Is it the last option here, which reads that the internal iliac artery provides minor supply to the pelvis? So out of all these options, as it relates to the general blood supply of the pelvic cavity, the correct option here is that the internal iliac artery supplies mainly the pelvis. We know that the common iliac artery is seen to terminate into the internal and the external iliac arteries. We know that the external iliac arteries is driven or directed towards the lower limb, where it will be supplying this region. And we know that the internal iliac artery is what gives off a number of branches within the pelvic cavity to also supply the pelvic viscera. So this option here is the correct option. All other options as relates to the general blood supply of the pelvic cavity are incorrect, except for this. So thanks for watching this video, and let's have your grades in the comment section.